what are the signs that somebody may have a parasitic infection? Maybe not even having these like intense intestinal things, but less obvious signs.
Yeah. So obviously you're going to have people that have panic attacks or anxiety or things that can be up front in your face, gut issues, things along those lines. But I've had patients that had parasites that had migraines all the time. And it wasn't until we addressed the parasites that their migraines went away, or they're not sleeping or eating in the middle of the night. If you're waking up and feeling hungry and needing to eat, that's not normal.
No, it's
And
not.
a lot of times that is a sign that there's parasites happening or insomnia or
Because parasites are more awake at night.
Welcome to the Forward Think Tank podcast, a place of hope, inspiration, and education around holistic health and healing. I'm your host, Jamie Mazza, a holistic health coach, mental health advocate, and dancer. Join me as I share out-of-the-box conversations with integrative doctors, healers, and exceptional forward-thinking individuals thriving on the other side of their health challenges, as well as stories from my own personal healing journey. Thank you for tuning in. I'm so happy you're here.
Hello, friends. On this week's episode of the Forward Think Tank, I bring on Alicia Hickson. Now, she is a special episode for me, a milestone, because she is the first guest I've brought on who is not in my immediate network, not a doctor I've worked with, not a friend. It was really wonderful to have this conversation with her for multiple reasons. She's actually my friend Callie, who I brought on a few episodes back, who also had been diagnosed with a thymoma. If you haven't watched that yet, please go check that out. But she has worked with Alicia through her diagnosis to help her heal, and Alicia has quite a array of trainings under her belt, both from the conventional lens and also the metabolic approach. She's trained and worked with Dr. Thomas Seyfried and Dr. Yu, and she's such a light. As soon as you step into this episode, she is bursting with knowledge. She's clearly passionate about what she does, and she has a huge heart, and I'm so grateful that we were able to connect. This episode, we speak about a topic that I haven't really brushed on with other integrative doctors, the emotional health piece of a diagnosis and why it's critical to address it. And she did it so eloquently. I think it's something that is overlooked when you think about healing a chronic disease. It is such an important piece and often an underlying root cause of what may be causing an imbalance in the body. We also talked about my new favorite topic, parasites, and the common symptoms you may have if you have a parasitic infection, where we get them from, foods you can eat to help prevent or limit parasitic infection, because as she reminds us, we all have parasites in our body. They are a living organism, and it's more so problematic when there are maybe other things happening underneath the radar that can cause more of an infectious situation in our body. So we dive deep into that, which was truly fascinating. I learned so much. To give you a little bit about Alicia's background, she is a PA, so physician's assistant, and the visionary founder of Rayma Health, a practice rooted in the belief that healing is best achieved through a comprehensive, integrative, and personalized approach. Alicia brings a wealth of clinical experience, academic achievement, and heartfelt dedication to her work in functional and integrative medicine. Alicia earned her Master's of Science in Physician Assistant Studies at Des Moines University and holds a Bachelor's of Science in Biokinetics with an emphasis in human bioenergetics, along with a minor in psychology from Bethel University. Her early research focused on the profound impact of nutrition on chronic disease reversal, leading to several co-authored published papers examining the diet's role in conditions such as diabetes, hypertension, hypercholesterolemia, and mild cognitive impairment. Her career has spanned global and local stages, from serving as a medical mission coordinator in the Philippines to helping patients navigate complex chronic conditions back home. Alicia is a certified functional medicine practitioner, Bredesen Protocol certified, and a certified metabolic approach to cancer MAPC provider through Nasha Winter's program. She continues her advanced training under mentorship of leading metabolic researcher Dr. Thomas Seyfried and collaborative nutritional oncology expert Miriam Kalamian, with a special focus on metabolic therapies for cancer, cognitive decline, autoimmune conditions, gut health, hormonal imbalances, environmental toxicity, and Lyme disease. Alicia designs custom, evidence-informed care plans for each patient. Her clinical philosophy centers on empowering individuals to become active participants in their healing, using tools like nutritional IV therapies, hyperbaric oxygen therapy, therapeutic fasting, and advanced lifestyle medicine. Beyond the clinic, Alicia finds joy in fishing with her 2 young boys and her husband. She's also passionate about culinary creativity, clean eating, calligraphy, and continuous learning. Known for her empathy, perseverance, and holistic mindset, Alicia is deeply committed to helping people become the healthiest versions of themselves, mind, body, and spirit. This woman completely impressed me. Alicia, don't know how old you are, but she has the appearance of someone who is 18. She has a very youthful energy, and it was truly contagious. This conversation allowed me to learn a little bit more about, 1, parasites, which was fascinating, and 2, that healing is so much more than physical, which I've always known. But she reminded me of books like The Body Keeps the Score, which is something that's been on my mind to read for over a decade now. The fact that everyone in this country in a chronic state of stress, whether we recognize it or not. So she has a lot of great tools, tips, food for thought in this conversation that I think everybody needs to listen to, whether you have a chronic disease or not. So Alicia, thank you so much for sitting with me. It was an honor to have you as my very first guest outside of my network. This is such a wonderful episode, chock full of information, so many nuggets of wisdom. Please enjoy this episode. As always, share it if you like it, if you found it helpful. Send it to a friend, post it to your stories, anything you can do to help us reach more people, because I think Alicia and I both hold this passion for wanting to help as many people as possible and bring awareness to things like the metabolic approach and different ways of healing your body from a holistic lens. So please welcome Alicia to the Forward Think Tank. Alicia, if you're watching this playback, thank you so much for your time, and please enjoy this episode. Hello, everybody. Welcome back to the Forward Think Tank. I am here today with Alicia Hickson. She is a practitioner. She's actually my friend Callie's practitioner, which is how we found each other. And she has a very unique training. She's got experience on both the conventional side of cancer care and the more integrative side. So I am so excited, Alicia, to pick your brain. And we are going to be talking today the emotional side of healing when it comes to things like cancer and chronic illness. I know for me, that was a big piece of what was kind of going on unresolved. I also can't wait to pick your brain about parasites, because that's something that's really been top of mind for me lately as well. It's a different angle than what I've talked to some of the other doctors that I've brought on here. I'm so thrilled to have you. Thank you so much for your time, and thank you for being here.
Yeah, thanks for having me. I'm excited to talk about it. All things that I'm very passionate about, so it'll be good.
So tell me, and for those who don't know you, what inspired you to get into the world of cancer care?
Yeah, great question. So when I was in high school, I was a bookworm. I loved hanging out with my teachers. I spent a lot of time just studying with the science teacher I had in high school. And essentially, when I connected with him, I learned a lot about his daughter. His daughter actually had battled cancer. She was in remission. And then through our relationship, she actually got cancer again. And then by the time of my end of high school, she ended up passing away from cancer. And so I got involved with a pediatric oncology foundation that she actually founded with her oncologist. Called the Cure Foundation. And so through that, I got to connect with a lot of kids. There was a lot of young kids with cancer. I learned a lot about the lack of funding in the cancer world. And I knew I wanted to be in the cancer world somehow, but I struggled with going the conventional route, because I was like, if our route works so well, why would a 20-year-old that was an athlete, healthy, ate pretty well, really like outgoing, why would she have cancer, and why would she not respond to treatment? And so everyone would be like, well, what do you want to do? And obviously you're so passionate about cancer. Like, what are you going to do? And I was like, I don't know. Like, I'm going to work in the cancer world somehow, but it's not going to be conventional, and I don't know what it's going to look like. And so I just kind of let, the Lord just show me what that was going to look like eventually. I went to college in California for a couple of years, and then it drew my heart to go to a school called Bethel University here in Minnesota. My teacher's first day of teaching was my first day of school at Bethel.
Wow.
And she just started talking about just biochemistry of diabetes, right? And so how we give insulin, but really it's an insulin resistance issue, and like how you can reverse this, and just understanding that there are root causes and you can address the root cause, and talked a lot about diet and so forth. And as this course went on, she started handing us papers to review. And one of them was the ketogenic diet and how it decreased the sizes of tumors. And it was written by Dr. Thomas Seyfried.
Meant to be, right? Your worlds are clicking. You're like, okay, ask God for a sign. And here we are. And things are just kind of falling into place, it sounds like. So awesome. Yeah. Keep going.
And so like when people talk about flow, like when I was in her class, I'm like, I need to know everything you're saying to me. Yes. And so then when I saw this paper, I did the same thing to her. I was like, I want to know everything he understands. Like this now makes sense why kids get cancer, because it's so much about like, they could be exposed to things in utero. Like, for example, I think babies get like 2,000 to 3,000 different chemicals and toxins are given in the umbilical cord itself.
Wow.
And so if you know this information, and during development, they were exposed to all these toxins and chemicals, and then you incorporate genetic mutations that don't allow them to detox well, all the different compounding factors, glyphosate being in so many of our kids' food. If you understand these concepts, then you can understand why it's a metabolic issue, not just a bunch of bad luck.
Yes.
And so then my teacher was like, reach out to Dr. Seyfried. And I was like, I am 19 years old.
What do you mean?
I just want to understand it. So I was like, whatever. I reached out. Worst case scenario, he doesn't answer me. I reached out and he was like, you should call me. And so I was like, okay. So I talked to him for 2.5 hours. I remember I walked around this square for 2.5 hours just talking to him. And basically I was just telling him everything I learned from. And so he was just a soundboard and was like, yes, this is so cool. And he's like, there's so many people that don't understand this, and you're 19 and you understand it. And I was like, yes, because it makes sense of all of the things I've been doing leading up to this point. And so he pushed me and was like, well, you just need to get like letters behind your name to have like a platform to do this. So then he kept feeding me papers. And then I decided to go to PA school. I don't need to be a medical doctor to do these things. I just want to see patients. And at that time, I was very averse to conventional care because like my mom was, I would say, a victim of polypharm. So basically just dumping medications on her for different issues and never really helping her. Prescription bottles was not something I liked seeing. I'm just going to go to PA school and I'm going to just be all integrative and just listen to what they have to say. And then the Lord totally changed my heart of understanding that conventional care has a role and is very important, and they are great firefighters, but the gap that is present for the chronic illness. And that is where like I was able to start learning and jump started my engagement in integrative oncology, but then also just chronic illness in general, and then prevention, because there's so much if you know it ahead of time.
Yeah, you just shared so much, and a lot of what you said spoke to me and like my soul. I went to school thinking that I wanted to be a psychiatrist, and similar mindset where I experienced my own issues with mental health and something I still struggled with up until honestly maybe like 5 years ago. I knew that I didn't want to prescribe medication, and that wasn't, the way it was going to work for me. So I held off, and still to this day never went back to get my master's or pursue anything like that because I really wasn't sure where I wanted to go. And then I ended up, 12 years ago at this point, finding a holistic nutrition certification program. And I was like, okay, this marries things that I had been doing. I grew up a dancer and I loved fitness and started eating well, and then started, as I'm sitting here with like a breakout on my face right now, started trying to get to the root cause of my acne and what was flaring that up. And so I didn't go back to school and pursue mental health in that way, but I feel like it's really come to the forefront now. And then doing a lot of the work that I did even like 5 years ago at the beginning of the pandemic, I lost my best friend, unfortunately, to suicide. And so that started my journey with finding a really incredible therapist. And a lot of that work that I did, then finding this diagnosis, and at the end of 2020, have this strength inside of me that I never knew existed. Also talking about, God speaking to you. I felt that shake on the shoulder in the hospital when we were trying to figure out what was going on. I just heard this voice, you're going to be okay. This is not going to be easy, but you're going to get through this. My husband, thank God, ended up finding the metabolic approach and ended up finding somebody, not Callie, who had a thymoma, because they are rare. And so it was like, you're going to share this journey and teach people, which is something I've always loved to do. Here I am with this podcast, and all the more reason why I want to have people like you here to talk about these things, because I think in my world, they're becoming more common, but I think to everybody else. And to your point, it's conventional isn't everything. It's not the solution to get to the root cause. And there is such a very blaringly obvious gap between being proactive and being reactive. So thank you for sharing all of that, because I'm sure people who are not familiar with the approaches that you and I are now so rooted deeply in, it's like that makes a lot of sense. And childhood cancer is sadly, I know too many people who are now watching their children go through this, and I can't imagine. I'm an adult, so I am able to read studies and books and talk to people and make my own decisions. But as a parent, I can't imagine that feeling. So the fact that you were able to see all this at such a young age and be like, I want to know more, I want to be a part of this, and I want to really help people heal is truly incredible to realize at the age of 19. I commend you. Kudos. So you, similar to a lot of the doctors that I've worked with over the last year and a half, found Dr. Winter's training, and then you mentioned training with Dr. Yu. So do you want to talk to me a little bit about those experiences and trainings as well?
Yeah, I'm going to talk you through, because when you say you were brought through this whole experience, but you're using it for good, right?
Yeah.
And to understand and use your real life experience to seek out more information, that this story that I went through will help bring, I didn't even realize it till now when you're talking, an avenue between the two concepts we're going to talk about in terms of parasites and emotions. So when I went to Bethel, the year before that, I had gone to the Philippines. And when I was in the Philippines, I came home and had extremely bad gut issues. And they were like, yeah, you might have just eaten something. Here's 1 dose of albendazole. And in this process, in about a year span, every time I'd eat, I'd want to throw up. I was extremely anxious. I was suicidal. I was having all of these emotions simultaneously while I'm finding all of this stuff, right? Checked myself in because I was like, I know I'm not okay and I don't know what to do. So I had gone through all these testing, allergies, all this stuff. And one of the ladies was like, well, it sounds like you have an eating disorder. And I was like, my body feels like I don't want to lose weight. I was an athlete. I was a college athlete.
Yeah.
I was okay and confident where I was. It just, after I'd eat, I'd feel these certain ways. And so then I was like, fine, I got to do something. I checked myself to Melrose, and it was an eating disorder clinic, and went through this whole process, which was traumatic in itself. And by the end of it, like, I had all these coping mechanisms around eating, but I would still eat certain foods and feel terrible.
Yeah.
And still, like, now I'm not going to make myself throw up, but I was like trying to like figure out what else to do and why do I still feel this way? I didn't feel like this 2 years ago, so now I'm feeling this way.
You're like, this is not self-inflicting. I'm not trying to feel bad. I just physically feel bad. Wow.
So when I met this integrative provider, was my teacher, she was like, it sounds like you may have like a gluten intolerance potentially. And so then one of my biggest things was whenever I eat cookies or things like that, I wasn't a big bread eater, but I would eat cookies, I would get this anxiousness. I was convinced I was like allergic to carbs or sugar or something. And so I tried a gluten-free cookie. And so I did, and it like made me less anxious, but I still felt anxious. And so I was like, okay, well, I'll just be 100% gluten-free. And then when I started to learn more about Dr. Yu and Dr. Seafried and all this information and all these components, and I was diving into this people with her and understanding it, what was actually happening was I had a parasite from the Philippines that had never been addressed. I developed celiac disease as a result, because there was so much inflammation over a long period of time. And then within 10 milliseconds from your belly to your brain, you have inflammation and reactivity. So when I was eating like sugary, carbohydrate dense foods, and also like gluten, which is inflammatory, I was having an inflammation process that was happening in my brain that was making me feel like I needed to throw up because of the inflammatory process that was happening. I went through this entire parasite cleanse, and I remember like crying. I was like, called my mom, and I was like, Mom, this is the first time I didn't wake up that I felt like I didn't want to be here, that I like could make decisions for myself, because like I feel like I was like making impulsive decisions on certain components and like feeling super anxious about what I was doing when I was doing it. And I had to like always be on to like be in charge of myself, I guess I should say, because I was not functioning. Like it was affecting me playing soccer, especially the second year of me playing soccer. And after I went through this whole parasite cleanse, felt like I was euphoric. I was like, holy crap, my brain is back. And I just 100% gluten-free. And at that time, when I was in that process, my whole family was like, Alicia, you're going crazy. You can eat an Oreo, eat an Oreo. I remember like trying to, and I was like, okay, I'm going to mentally prepare myself to eat this Oreo. And I ate the Oreo and I was like, okay, I'm not going to throw up. So I ran 2.5 miles to get my body to try to calm down because I didn't know what to do.
Are you still walking around in those leggings leggings full of microplastics. I know, seems like nothing is safe anymore, right? It's ridiculous. I recently started changing over my clothing to more sustainably sourced, no harm to me brands, and I have been obsessed lately with Woolly. It's made of 100% merino wool. Honestly, you have to try. Merino wool, it's naturally finer than your average wool, so don't think about like your grandma's wool, right? It's made of smaller, breathable fibers that actually regulate your body temperature. So I wore their leggings in the dead of winter when I was trying to get out every single day, even if it was 15 degrees post-op. I had not an ounce of body fat on me, so I was always freezing, and I was shocked at how it kept me warm and insulated on my walks. So obsessed. But it also wicks away moisture from the skin and is quick to dry. So really perfect for, now that it's getting nice out, we're going outside, we might be sweating a little bit. It's all good. It will regulate your body temperature. It's truly amazing. So I've been obsessed with their leggings. I also have short and long sleeve tops from them, which again are just so fine and soft to the touch. I was honestly shocked, and they're comfortable. They're cute. I mean, they have everything from like underwear to athletic wear. I can't wait to try more, but I had to tell you about this because I know honestly for a lot of people who are hyper conscious, I should say, about wellness are looking at the trending topic of microplastics in our Lululemon leggings. So if you're looking for high quality athleisure gear that won't add to your plastic burden, I highly recommend you try Woolly. They have everything, like I said, from athleisure to underwear, and you can get 15% off your first order using code JAMIEM15. That's JAMIEM as in Maza, 15 at checkout. So head on over to Woolly, WOOLLY.clothing and check them out. Enjoy.
And so then now I was in a space where I was able to eat food and not feel anxious. I was able to understand. And so when you do a parasite cleanse, I was very aware that there were parasites and coming out of me. I was like, whoa, this is wild. And now when I look at patients, I get it. I get you're going through something that people aren't checking for and you need support and outside the box. Because I could have gone through years of eating disorder clinics and it wouldn't have made a difference. I sit here now with patients that have all these emotional components. Dr. Simon Yu, he talks a ton about parasites. He was a doctor that served in Bolivia. And essentially all he had access to were antiparasitics. And so he just started like treating people with antiparasitics, and people were coming back to him and they were like, my cancer is gone. My asthma went away.
Whoa.
My allergies are gone. He was like, what? Like, I gave you albendazole and ivermectin. Like, how is that possible? I treat you because you were exposed to parasites. Like, that's what. And so, but he was doing these high doses, like he was doing all these different components. And so then he learned more about how to use these antiparasitics, and then seeing ivermectin, parentoplomoy, and praziquantel are actually 3 different antiparasitics that are used in our dogs every 3 to 6 months. And so most other countries do parasite cleanses every 3 to 6 months as a routine of self-care. And then we do this for our dogs here in America, and we're like, no, people can't get parasites because they didn't travel to Africa. But how do our dogs get parasites? They lick their faces, they like lick our food, and then we're like, no, parasites aren't a possibility. And if you look at the testing that we do for parasites here, we test for 2 different parasites. So if you test negative for that and you're not having excessive diarrhea, we're like,
then
nope,
you don't have parasites. In reality, I'm sure you could tell me there's got to be so many species out there, different types of worms.
And parasites are hard to pick up on stool culture. So yes, you can test negative for a parasite, but you could still have parasites and you won't notice it until you start killing them off. And so, because they have different forms, like there is egg forms that can be present. There are actual and full components. They can hide in your organ systems. Unless you're having blatantly obvious diarrhea or whatever, drastic weight loss, you're not going to really look at it. You can do a colonoscopy and have parasites and not know it. So a lot of times people are like, well, there's no way I have a parasite because I did a colonoscopy. And it's like, yeah, me too. I did a colonoscopy, didn't come out. Like,
from what I've learned recently, and this is, I mean, I can't wait to hear you just talk about all of it because I can see how fired up you are and how much knowledge is in there. For me, it was a whole new world when I got this diagnosis, and everyone's asking, what can cause this? What can cause this? I mean, I have a history of 12 years of just having like this roller coaster of anxiety, depression, gut issues, breakouts, to the point where like I had cystic acne so bad. Most of my adult life, I was on lots of medications, whatever, that then disrupted my gut. So like all these things that I was able to connect the dots, but I'm just like, damn. And then I see you talk about these things out loud. Your phone's always listening. Then I'm getting served all these things in Instagram. And I see somebody talking about parasites and how they can be related to cancer and sometimes mistaken for tumors or feed off of viral load, which I found was undetected in me, like mold, toxins, all these things. And so a lot of this is making sense. I actually asked my integrative doctors to put me on ivermectin before I did my surgery because I'm like, if there's any chance that we can break this tumor down, because my tumor was huge, you know, we were, thank God, able to find the right surgeon who agreed to do the surgery, and we had an R0 resection. But it was truly incredible. Had a little bit similar but different to Callie. Yeah, thank you. Had some collateral taken out of me as a result. So the healing process is very slow, but I was like, if we can do anything to help this be somewhat easier and break that tumor down, let's do it. And so I started having like this really itchy, hivey reaction all over random places on my body. And one doctor, because I was working with two at the time and still do consult them both, he was like, that's got to be parasitic die-off. And the other one was like, well, yes, if it's parasitic die-off, okay, but we're prepping you for surgery. And if you're having an inflammatory reaction, I don't want you going into surgery that way. So we kind of stopped. And then I, picked it up again because I'm like, I just feel like, talk about a gut instinct, LOL. There's just such a knowing that there's something related to parasites happening. And so pretty sure, not to be gross, but like definitely just passed one. And my doctors were like, did you save it? I'm like, no, ew, like what are you supposed to do? But now I know better. If I see something else come out, you can send it out and get it tested and see what it is. So,
and this is also like
mind blown.
And to loop together like the metabolic approach, right? So if you look at mitochondrial function, what cancer's environment loves is low oxygen, an acidic environment, an inflammatory state. Okay. Yes. And so I'm going to read this to you because this is information on cancer, but also what parasites do. Parasites itself promotes a microenvironment that has a hypoxic, acidic, and low oxygen environment, which is ideal for cancer survival. So if you are having parasites in your gut, in your body, whatever that looks like, it's going to suppress your immune system and then create that acidic reaction. And so a lot of times people are like, is it always just parasites or what is it? And it's a combination of things. It's not just parasites, but also if you have parasites, you're creating that environment, not just because of cancer, but because there's other things going on that's encouraging that environment in your cells. And let's get that out. So that's a huge piece.
Yeah. I'm already loving this conversation selfishly because I can't wait to learn all about this. Did you want to mention anything about Dr. Winter's training specifically?
Yes.
Make sure that.
So then everybody has nuggets, right? And so I've been honored to be able to work with all of these different people and see their perspective. Certain people are going to be passionate about parasites or passionate about the overall approach or passionate about metabolic health. I've gotten the honor to talk with all these people and see their passions and then conglomerate them all together, and that's me. And so in terms of Naisha, she focuses a ton on the terrain 10, and understanding the whole picture and seeing what buckets do we need to be supporting. And that's when we can talk through the emotional component of people so quickly overview emotions. Naisha will talk a ton about this in terms of how important your mental emotional health is, your nervous system. Understanding the vagus nerve and understanding parasympathetic nervous system is important. You have two different processes in your body. It's a parasympathetic nervous system and a sympathetic nervous system. Sympathetic is that fight or flight or being chased by a bear. There's several different buckets that could put you into that sympathetic nervous system. Too much sugar, not sleeping well, having a high stress load, having parasites in your body where your body in itself feels like it needs to is being chased by a bear because it's in your gut. Different areas that can trigger you into the sympathetic nervous system. And she's really opened my eyes. It isn't just one thing. You need to check the whole person and interview them, get a good understanding of what is happening before you start addressing it. Because one thing could work for you, but another thing is more important for somebody else. And patients will call me and they're like, well, what do you do for breast cancer? What do you do for colon cancer? And it's like, that's a great.
Yeah, it's not just this like packaged, here you go, like one size fits all.
Yeah. And so because I always say your journey to cancer looks different than anybody else. And it was all very individualized in terms of how you got there. And that's why it's also so hard to study this, because we don't have a cookie cutter approach to give to a person and then reduplicate to through other people. Because if you got breast cancer because you were sexually abused and have a high toxic burden, and then the other person had mastitis and has an infection in her tooth that's leaking into her breast, you're going to approach it differently. Those are things that nature really exemplifies when it comes to this, because it's not going to be cookie cutter. No one's cookie cutter.
Yeah.
We were not designed that way. And so why would we expect that one thing that's going to immediately work for one person has to work for the other person? Because we're not even designed that way in any area of our life. And so why would it be in terms of helping our body heal? And so that's like a huge piece of her. And then, yes, we're going to test to see what we're going after. But then once you address it, then retest to make sure it's working. Because there's so many practitioners out there like, okay, we're going to test this and it is this, but then we just have to go down that road and this is all we're going to do. But you need to retest it to make sure, one, are you over-treating them? Are they responding? Is it working well? Does it align with what they need? You have to ask these questions along the way instead of, here, just do this for 6 months and then I'll see you back. That's not how this works. And so that is how you're able to kind of bring those two worlds together and understand the patient the best way we can.
Yeah. Very well articulated. Thank you. I see you as this sponge because you want to learn from all the different angles. So you're looking at both sides of the coin, but you're also realizing that there's so many different approaches. Like you said, everyone has nuggets. Everyone has their focus. It's not just this mecca of this one training works across the board. You really took all of that, collected them like, seashells and said, okay, here's the tools in my toolkit, and this is how I'm going to utilize them, because everybody's different. Everyone has different reasons for these things occurring. And so therefore I'm going to create a personalized approach for you because that's what's going to make sense. So let's talk a little bit about your experience at MD Anderson and what propelled you to go there and to begin with.
Yeah. So when I was in PA school, I learned about MD Anderson, and it's the #1 cancer hospital in the country. I found out that we had an ability to do a rotation. You had to apply for it. It was a whole interview process to make sure that you're a good fit, and that you had enough education to be a good, candidate. And I applied. The more I learned about it, it's as integrative as a conventional system will get is MD Anderson.
Okay.
Because when you walk in the doors, you're going to talk to everybody. You're going to talk to an oncologist. You're going to talk to radiation, but you're also going to talk to a dentist. You're going to talk to a nutritionist, a therapist. They will give you all of these people when you walk in the door. And they're going to look at things differently. It's not going to be an integrative component, but it's as integrative as you're going to get.
Yes.
And they're thinking from other perspectives. And then it's a team that then they sit down and then they talk through your case.
Okay.
And so it's so cool. And I was like, I want to understand this. So I got into the head and neck center, and the guy that was my preceptor was actually a PA, and he knew about antiparasitics and how they react with cancer. And so then him and I were able to geek out about stuff because I had training, I understood things, he understood other things. And so we kind of talked through it, and there's a lot of limitations in a setting that you can't do, but also he was able to be like, hey, you should look into this. This might be a good idea.
Yeah.
I also then understood head and neck cancers, certain types of head and neck cancers, their success rate with even catching it early and doing radiation or cutting it out, things like that. It opened my eyes to be like, okay, there is a space for this conventional system because there's also like things that work really well for specific things. But then when you have more of these advanced cancers and things along those lines, then there's a gap. And so that is where like he kind of showed me like what they can be doing, and then helped me understand if we get to do a diet ahead of time, if we get their immune system reacting ahead of time before they cut it out. There's just things that we're able to toggle back and forth on, and then understand that some chemotherapies, we could do lower doses of it, or we can kind of manipulate it in different ways, especially if they're in a ketogenic diet. And when I say ketogenic diet, I want to like preface, a lot of times people think, eat a bunch of bacon, eat a bunch of cheese, don't eat any zero carbs. That is not what I'm talking about. I always encourage people to talk with a nutritionist because you should not be losing weight if you are doing this. There is a weight loss period that happens just because you're losing water weight. But if you're working with a nutritionist and you're doing it appropriately, you should not lose weight. And there's also good foods to be eating, vegetable-rich foods to be eating, things along those lines that are important. But when you combine these worlds together, you can see such a drastic difference. I didn't know all the things I know now when I was working with him, but he started planting little seeds that he had noticed. This person was using ivermectin with this, and they had a better outcome. Or, I'm noticing that when they're eating less carbs, this was what you notice with the patient. So it was cool to see his perspective, and he was wasn't just like conventional is the only answer. He was open-minded and seeing that these other outside toxic factors were encouraging cancer. He was connecting a certain toxin that people's cancer was growing rapidly with if they were exposed to it. And so it's things like that that got me thinking before I even was introduced to the like Naisha Winter's approach. And it like kind of primed me so that when I started understanding, I'm like, that is what he was actually referring to and he didn't even realize it.
Right.
And so it's things like that that has helped build my understanding, and also seeing that a tumor may be sitting on an artery and you need something right now. You know, metabolic approach is not going to fix everything overnight. And people understand that is that like, don't run away from conventional. There is a time and a purpose that can be very important, and we can be strategically using it, especially in a case by case basis, depending on what you're able to do. There is places for it. And that's where I opened my eyes when I went there of the importance of collaborating. And now I've gotten the honor to talk to several oncologists and tell them what I know and what I'm noticing in patients and get feedback from them and work together. Because when you have a humble oncologist and just a humble practitioner in general, they're going to understand we don't have the answers. If you look at the cancer rates, they are not getting better. Right. And so if we all come with it a humble approach and saying, I don't have all the answers, my approach is not going to cure it, most likely in many cases. If you're willing to talk with somebody else that has another mindset on it, then hey, let's talk. Let's open up that dialogue, because we're at this together. No one's going to sit there and say, I 100% have the cure to cancer and I know it's going to work 100% of the time. It's not.
If that was the case, we'd all be walking around healthy and we wouldn't have these issues. We wouldn't be here talking.
Exactly. And like MD Anderson, I still talk to regularly. Love hearing his perspective. Hey, they want to put him on X, Y, and Z. What do you think of this? I don't know everything about chemo, but it's good to know about it and also help people to understand. And so that's like where having collaboration and understanding has been a blessing.
Yeah. Now, was he the only person that you worked with, or were you exposed to other doctors in that setting at MD Anderson? It seemed like he was open-minded and had alternative knowing that you and him kind of shared.
A lot of like the oncologists, they were very, very conventional. I talked to other people. He is who I spent the most time with. And he's like, there's a couple people here and there that have interest.
Like us.
That are interested in it, but then their hands are tied because they're like, I don't know enough. You can incorporate it. Insurance doesn't cover it. And they step away from it. Really. But he was the biggest person that actually felt that way. I don't want to say that everyone there was like that.
Yeah. No, that's fair.
If you look at just MD Anderson by itself, it's as integrative as you can get, I think, in a conventional setting nowadays.
Yeah. Makes sense. I mean,
we'll have more of the sector, but at that point, especially, that's like was a really cool that they cared about these different components and were thinking about it versus I'm going to give you radiation. I don't really care what happens to your teeth. We'll move on. You know, like
very black and white
things.
Yes. Yeah. Well, awesome. I mean, I love that you had that experience and it opened your eyes to seeing things differently. And it also brought you to this person within the system that you now have as a reference and someone you can bounce ideas off of. I'm a perfect example of somebody who had a really large tumor. It was sitting pressing almost on my heart at one point and, wrapped around my phrenic nerves. We did end up trying chemo, even though there was no confidence in my oncologist that it was going to work. It was just like, let's try. But I was working with an integrative doctor trained under Dr. Naisha, who was like, here's why I'm okay with this, because it is, infringing upon major organs, your lungs, your heart, your diaphragm. As you said, the metabolic approach takes time and we don't want this to get larger. We don't want you to have serious health issues. I also was diagnosed with myasthenia gravis, which had gotten scary at a couple points over the last year and a half, but I've been in a really great place with it now. So they were not saying no to chemo. They're like, let's low dose it, to your point. Hearing that they do that at MD Anderson is great. My doctor was very hesitant, but he was open-minded and he was willing to talk to my integrative doctors. And even though he didn't see eye to eye with them, he was at least open to listen. That alone made me feel he might not be in my corner, but at least he's open. And whether or not he internalizes this information or not, I'm still going to do it. And it was helpful.
A lot of these oncologists, MD Anderson, they won't say we do low dose chemo, right? But some people will do I'm okay with you starting at 80% because I just want you. Some people there are going to be willing. I've now noticed being with more oncologists, they just want you in the door to start treating and helping you. And so a lot of times patients don't realize if they don't feel comfortable going full gusto at first, you can ask questions. You can be like, hey, can I do this instead? You have more say than you think you do, because so many of my patients is like, they're going to fire me if I ask questions. And I'm like, you should ask questions. Make sure what you're doing you feel comfortable with and you are informed by. And if you only feel comfortable doing X, Y, and Z, then ask to do X, Y, and Z. They're not going to be like, you only want to do 80% of chemo, you're out, can't help you. No one's going to do that. And if they do, like, that's not a great provider because you're not listening to your patient. And so once again, like, we don't have all the answers and there's not a cookie cutter approach. I talk to oncologists all the time that like, we're just manipulating dosages based off of their labs, because you can look at the neutrophil lymphocyte ratio to see if there's over treatment. I monitor that and then I educate oncologists about it, because like a lot of times my patients are like, well, if you know about this, why doesn't the oncologist check for it? Yes, you're not taught this in medical school to really look at, and unless they are passionate and are diving deep into these things, they're not going to know it. So it's not that it's not important, it's just difference in training. And when you start seeing the patterns more regularly, like this neutrophil lymphocyte ratio is going up 5-to-1, 6-to-1, 10-to-1 ratio. And I'm seeing this in real life, and their oncologist like, nope, don't change it. Don't change your treatment. And then 3 months later.
If you are listening to this episode and thinking, I have a serious healthcare diagnosis, I've been dealt the cancer card, I want to have help and support around ways that I can heal myself naturally using naturopathic healing, and I need somebody who gets it, please take advantage of this opportunity to work with my naturopath, Dr. Lori Bouchard. Dr. Lori was nice enough to offer a free 30-minute strategy call to dive deep into your personal needs, understand a little bit more about your unique diagnosis, and see how she could help. So if you have been listening to my episodes, maybe you sat down and listened to my interview with Dr. Lori recently, we talk about cancer as a metabolic disease. And so that really, when you look at it from that lens, you need to work on your metabolic health, whether that is focusing on your nutrition, focusing on certain things in fitness, maybe fine-tuning your supplements, working on, the mental health healing process. This is all encompassing and something you'll learn in the Metabolic Cancer Reset program. So this program is designed by Dr. Lori. It is an incredible program where not only do you get one-on-one time with her, you dive deep into your lab work that you look at in a very specific naturopathic lens on a monthly basis, but you also get access to her weekly group calls. So it is a great way to have resources, connect with other people who are going through something similar and who can only understand what you're going through and, just share their own personal experience. But you also get a program with Dr. Lori. So in her Metabolic Cancer Reset program, she provides multiple videos talking about getting into ketosis, talking about nutrition, talking about fasting, talking about, different ways to even work with the conventional side of treatment. So if this is something you're interested in, or maybe you're listening thinking, I really want to send this information to a friend, to a coworker, a family member, a significant other, somebody else who may be dealing with a significant healthcare diagnosis of their own, and they're looking to get support on their healing journey, Dr. Lori is providing a free 30-minute strategy call. So take a look at the description of this episode. I will link it below. Free 30-minute strategy call with Dr. Lori. I promise it will change the game in terms of your healing process. So I hope you enjoy, and thank you, Dr. Lori, for that gracious offer.
The tumor goes, I saw this happening 3 months ago and we didn't want to do anything about it. And so it's now take that and have that conversation with oncologists. You can see this. It's not that chemo in itself, like you have to completely get rid of and you can't do, but like, let's listen to what's happening. Yeah. Because if you look at the studies, higher neutrophil lymphocyte ratio has a poorer prognosis and a poorer response to chemotherapy. And so if you just listen to that and see it and let the body have some time, you're going to have a better outcome. 7 times out of 10, maybe. Oncologists are going to listen to that because they want to have a better outcome. Right. And so you just got to give them the studies and data.
Yeah. Good for you. And good for you for encouraging your patients to ask the questions. I didn't feel good about going through chemo. I really resisted and I didn't believe it was going to work. And it really didn't, show us the results we were hoping for. There's something to be said, one, for like believing in what you're doing, and two, feeling comfortable. Because when you feel uncomfortable, and I think this will like lead us into deeper about like the emotional piece, if you feel uncomfortable and stressed, your body is going haywire while that's happening. Like stress creates such a ripple effect in your entire body. So the fact that when you and I got on the phone and connected for the first time, and you mentioned that it's really critical that you have the conversation with your patients about the emotional piece. Tell me a little bit more about that and why you think that's so important in something like cancer or any type of chronic disease.
From a biological standpoint, you can actually test them. So chronic emotional stress, like grief, trauma, anxiety, actually decreases natural killer cells in your body, which natural killer cells are important in destroying cancer. Natural killer cells, you can test for that. It also is known, it is a known fact, which we are taught in medical school, that grief or not forgiving people suppresses the immune system and it increases the risk of chronic illnesses. It promotes inflammation. If you are in a high stress state, it's increasing your cortisol, which increases your blood sugars, increases your insulin, encourages visceral fat storage, encourages an inflammatory state that happens in the body. And then when you're chronically in this high cortisol state, it shows that there is actual DNA damage, because if you're constantly being bombarded with stress or feeling like you're being chased by a bear, if you're being chased by a bear, do you care about the fact that there may be a cell in your body that's abnormally replicating that potentially could be cancer in 10 years?
No, because you don't want to get eaten by that bear.
Exactly. And so that's the best way I put it, is that the repair system gets shut down. And so that's when you see more of that mTOR instead of that rest and digest, or you have something called P53 genes that are your housekeeping genes. So they go through and they're like, ooh, this doesn't look good, we got to fix it. Or, ooh, this doesn't look good. Okay, we're going to send it to like apoptosis. We got to kill that cell because that doesn't look good. And so it does all these things, and it does it a lot when you're in the state of resting and digesting. When you're always living in a state of fight or flight, you're not using that P53 gene very often. You're just ignoring these random growths that are happening. So then that's when you see people, not just cancer, but develop high blood pressure, develop gut issues, develop all these things, because the immune system isn't recognizing what's happening, because it's so worried about you being chased by a bear. And unfortunately, here in America, we are always in that like go, go, go mode. And people are like, well, I just work a lot. I don't have anything traumatic that happened. I'm like, yeah, but you're not sleeping. You're stressed. It's not bad stress because you like what you do, but your body's up here all the time.
Yeah. Your brain doesn't know the difference, honestly, unfortunately.
Exactly. One of my patients is a huge advocate for the Aura Ring. And I was like, okay, let's see people talk through this. I'm going to do this. I love what I do. I'm not a super, in my eye, I think I'm stressed, but I was like, let's just see. Because I get really excited, right? Let me look at it. I got it for Valentine's Day and I started looking at it. And one of the days, my heart rate was elevated for 8.5 hours.
Whoa.
And I was like, oh, okay. It wasn't that I was stressed out about my patients or anything like that. I didn't know how to like bring myself down. I put a lot of pressure on myself to make sure I was saying all the things I needed to say, do all the things I needed to do. And not that I don't still do that, but it looks different. I can help this person, but I don't have to have that same mindset of like being so overwhelmed and stressed by whatever I'm saying. I can bring myself down. And it made me more like aware, because I wouldn't have known that if I didn't look at my heart rate. And your heart rate, if you know it's increasing, most likely my cortisol is increasing because of it. Most likely that my blood sugars are increasing during that entire time. And you hear people talk about like their blood sugars, for example, and they're like, well, my blood sugars are staying high and I'm not eating any carbs. But are you stressed? What kind of stress are you incorporating? That's also going to spike your blood sugars and it can stay high. So then you see people's A1C elevated and they're like, why is my A1C elevated? I don't need a ton of carbs. A lot of times it's because your blood sugars are high because you're just stressed all the time. That's where when you think about like the emotional component with cancer, it makes so much sense. One of my patients that I can think of, she had stage 4 cancer, breast cancer, basically was given, I think like 6 months to live. And she started coming in and talking with me and we had this whole conversation about her history and I got to know her. She had this extremely traumatic like relationship that was still impacting her and no one talked to her about it. And I was like, we got to get you out of this situation. We got to get you a better support system. We changed her diet a bit. We did a couple things here and there. She is now 2 years with no evidence of disease.
Oh, that's so amazing.
I would love to say it was like, oh, the supplements and things, but her baseline was pretty solid.
Yeah.
And so we helped calm and regulate her nervous system. It was the biggest thing. She actually gave me a gift for when my son was born. When I started thinking about opening my clinic, I wrote all of the things of what I wanted Rayma Health to look like. I have it framed and we're going to put it in the office because that is why I do what I do. I just ask the questions other people aren't, and I want to make sure that we are addressing what they need to have the best possible outcome. I didn't even realize that where her diagnosis was at the time until about a year later, and her son was sitting with me and was like, kept thanking me. And I was like, what? Like, you forget after you
Yeah,
see
it's
people
just
for a
what I
while.
do. Yeah.
And when people are approving, you're like, great. And you just keep going. I don't focus on like the prognosis. Like that's not
Yeah.
my mindset.
You're also not there to wear like the badge of honor. I could tell you're someone who just genuinely cares, but you're also like, okay, this is working. Let's keep going. I can see how much it lights you up, and you're not in it for praise.
Yeah. He was saying this. I was reminded because I genuinely did not remember where we started. I remembered that we had stage 4 cancer, didn't remember that whole process. And he reminded me of that. And I was like, holy smokes, this is awesome.
Yeah.
Oh,
Yeah.
celebrating because this is so cool. And she like now is like living her life in California and doing all these things and in the redwood forest and just joyful and elated that like she's out of this. We monitor still and all of these things to be careful, but this is why we do this. And this is why you should care about emotional health, because you read this in study books. If you don't address your emotions, then you may not respond well to chemo or you may not do it. But when you start seeing this time and time again with patients and you see like the ones that don't want to address their mental emotional health, like, I don't want to think about all that yuck. I have cancer now, and
suppress.
I need to address that. And like that is my mindset. I don't want to talk or think about these things. But we need to talk about and think about these things to let the body release. There's actually a book called The Body Keeps a Score. A lot of times patients will understand I hold a lot of stress or trauma in my shoulders, right? I have a lot of tightness in my shoulders. But we don't realize you can hold grief in your liver. You can hold a lot of like worry and grief in your belly. You can have like sexual emotional traumas are known to like increase the risk of breast cancer and gynecological cancers. We know that when you're suppressing emotions or have a lot of trauma, sometimes that can associate with brain tumors. Not that in itself, by itself, that's what's causing it. But if you're not addressing and opening those things up to help your immune system fight these things off, it's going to be really hard. And also, yeah, we may get rid of the tumor, but what's your risk of it coming back? Because you never addressed what was really the underlying reason in the first place. Not only should you want to care about your different buckets to get rid of cancer, but care about your buckets so cancer doesn't come back. Care about your buckets so you don't get cancer. And don't wait until you're at that space, that dire space where nothing's working, and then you're forced to care.
Absolutely. Yes. You just said so much. It resonates. It hits. And I love the examples that you brought up, because for me and also a lot of people walking around, it's like, I'm not stressed, right? I don't perceive my job as stressful. I'm thinking about how I used to rush to the train. I live right outside of New York City. So like you had to make the train by a certain time. So like you went into like a state of fight or flight every single day. Even things that you think you've let go of, like old relationships or my best friend taking her life, or even little things from childhood that you realize when you talk to a therapist, that these things can influence and can hold space in our body and have a ripple effect on every system. Our doctors in conventional care are so siloed to look at things very in this department, but our bodies as a whole, everything's communicating. It's really wonderful that you encourage patients to look at that. I know you yourself are not a therapist, but are there certain therapies, types of emotional trauma release that you would recommend to somebody?
Yeah. So I ask the questions and then I'm like, we need to have an EMDR therapist on board. EMDR is eye movement desensitization repolarization. The only trauma or trauma therapy that has proven, I think now brain mapping or ART therapy is now another one that I think is up there, but to help with the trauma response. And essentially what it does is it reconnects the brains. For example, if something bad used to happen all the time behind locked doors, when you go and approach a locked door and try to open it, you may get stressed. You may not know why, but you may just get annoyed, frustrated, and ramp up your emotions. And essentially what EMDR therapy does is it's going to dull the lines. Instead of you saying locked door, I need to have a stress response, it's going to say the door is locked. Well, it may be something bad happening. It may be somebody's going to the bathroom. It may be my kid accidentally locked the door. So it brings your brain through other processes, because at one point in your life, that trauma response was serving you because
saving you.
It needed to protect you from what was happening. And that's the same concept, trauma. It served you well when you went through that traumatic response from your friend passing away, because it needed to protect you to help suppress a little bit so that you didn't just lose it, right? And so it served you well at that point. But at some point, we need to let the body process. We need to let the body remove that emotional heaviness and letting it just push out and be like, okay, I am okay now. We are okay. We are safe. I am able to now think about that incident and not have a physiological fight or flight response. It's sad that it happened, but every time I think of it, I don't have to go back there, or I don't have to have a reaction that is affecting me now, because we need to let it go and let it push out. Love patients having an EMDR therapist. I have one that I've personally seen. I send a lot of people to her because I know she does a good job. Because with anything, not all therapists, not every practitioner is created equal. I always encourage people, if you're not local, find someone that somebody else has done it with, so that you know that it's good, or they're doing it appropriately. Some patients, I don't want to talk about it. I then recommend them to do cranial sacral therapy or more body work, because it can be helpful for their body just to start processing. That can be helpful, at least a good starting point, because then you're calming the nervous system, and then they may get to a point where they're ready to do it, or ready to talk through, or if they're in a high cancering state, adding in trauma work right off the bat may be not the great idea.
Might be too much.
You need to do something that's a little bit more calming and less aggressive. Also, walking will elicit the eyes to go left to right. And there is a level of almost what EMDR does, just walking in nature, helping your brain process through things, thinking about what's happened, and then going and letting the eyes go left to right while you're walking. Sometimes people just need to start with that. It just depends. And you really address where the patient is or what the patient's needs are, and openness to doing it. Let them at least recognize this is a problem. That is such an important process, is recognizing that this is an issue. We don't have to dive super, super deep if you don't feel comfortable. But let's try to understand that we need to start making steps, even if it's a baby
small steps. Yes. I love this conversation so much. Okay. And I wish I had 3 hours to talk to you. Let's go back to parasites, because it is something more people are starting to see information about, and ask questions, wonder if they have a parasite. We definitely talked about the connection between chronic illness and parasites. What are the signs that somebody may have a parasitic infection if they're not having these intense intestinal things, but maybe less obvious signs?
Yeah. So obviously you're going to have people that have panic attacks or anxiety or things like that can be really upfront in your face, gut issues, things along those lines. I've had patients that had parasites that had migraines all the time. And it wasn't until we addressed the parasites that their migraines went away, or they're not sleeping, or they're eating in the middle of the night. That's another really big parasites, because if you're waking up and feeling hungry and needing to eat, that's not normal.
It's not.
A lot of times that is a sign that there's parasites happening, or insomnia.
And that's because parasites are more awake at night. Is that true? Yeah. Creepy.
Or anal itching. A lot of times people will notice at a certain period and they're just anal itching, and it's kind of weird.
Yeah.
But that can be a very dull, easy sign that there's parasites going on and you don't realize it. There's also certain parasites that can cause OCD tendencies. So if it's really bugged by not necessarily full on OCD all the time, it can be when my husband doesn't put the book in this certain spot, or doesn't put the remote back in the spot, and you need to go grab it, or you need to take a shower. So there's so much rhythm that you have to do that it's hard to pull you off of baseline. Not that it's bad to have a routine, but what is your emotional reaction to when you are off your routine? Things like that can be subtle. Obviously, there's other things that can cause these things as well, but just to be aware that it may not just be upfront in your face that I have a parasite. It's different subtle symptoms. And also, most people have parasites. That also is there also are good parasites. I want people to understand this, that parasites are a normal part of the gut biome. Okay. And there are parasites that do serve us in certain realms. They actually gobble up metals, so they can help also detox in a sense. But when you have an overgrowth, I think of it as if you have a beautiful mountainside and you have a couple parasites, we don't have to treat those. That's okay. Your body's still functioning pretty well. You're still able to create vegetation. You're doing well. If you have a swampy area, okay, if you have worn down houses and just yuck area, and then I put a couple of parasites, then it overwhelms the terrain. We want it so that we don't get to a point where it overwhelms the terrain. When it comes to parasites, some people will do a parasite cleanse every 6 months or every year or something along those lines to help bring it down and encourage your immune function. If you live on a farm, if you are working with a bunch of kids all the time, or you are going out in public or traveling or drinking water that you don't normally, or eating foods restaurants that you don't normally eat at, or whatever that may look like, we're exposed to parasites all the time. One of my patients from Brazil, she's like, you guys are so weird. And I was like, why? She goes, you guys throw away the avocado pits and we crush them up and eat them because they're great antiparasitics.
No,
and I was
kidding.
What? These other countries, you don't have to necessarily go on antiparasitic medication. There are foods that pumpkin seeds are also really great antiparasitics.
I've seen that. Yeah.
Things like this that we can be incorporating, especially when you've decreased the load. So like when people like have
Right.
a high load of parasites in the body, you want to do a good parasite cleanse. You don't want to just kind of treat them, because then what can happen is they can go and hide in different organ systems.
So sneaky.
But then if you are in a space where your gut's pretty healthy, you may want to do just a little bit of these things here and there to help your immune system, help the body flush, help the body heal, and have it be more as a maintenance tool. When it comes to people that truly have parasites and parasite issues and these TikTok trends of let's try this cleanse and that cleanse and whatever, I just get nervous because it's like, are you actually getting rid of them? Or making the problem worse over time. That's where I tell people to like approach with caution, especially if you really think you do, making sure you're doing a good cleanse.
Yeah, not to get gross and graphic, but to know that they're leaving your system when you're doing a proper cleanse and you're seeing it come out in your bowel movements, or are there other ways that it would come out?
Necessarily, some of these parasites are microscopic. So that's where I think working with somebody that is educated in this realm, they're going to be able to help see what level are you needing, where are you at in the spectrum based off your symptoms, and learning and understanding the process. I think that's a big thing because you don't always see it. Like I said, you can do a colonoscopy, have parasites. It's not that because they're hiding necessarily. It's just because you don't see them because they're microscopic. They're not taking swabs and looking under a microscope to see what they see. You're going to have bacteria.
Such a good point.
Parasites and things like that in your stool, and you don't see it.
Yeah.
And so that's where it's nice when you see it, right? Because then it's like refreshing that you're getting
satisfying.
It's other than that, you don't always see it. And that's also normal.
Right. Are there things we can do to protect ourselves from parasitic infection to the point where obviously becomes a problem? I would say, yeah, you want to make sure your terrain's in place. I'll let you answer that. Are there things that we can do?
I think big thing is caring about what kind of water you're drinking. Reverse osmosis water is really different types of water systems just to make sure it's pulling parasites out. Like I said, it's kind of inevitable if we're going to get exposed. It's just how bad and how much. Keeping your immune system up, supporting your gut health, making sure you're having bowel movements every day. Not like, oh, I'm kind of having a bowel movement every day. Making sure you're fully emptying, making sure you're supporting your immune system, helping with Epsom salt baths, saunas, things that are just regular detoxing your body. And then good processes like every 6 months to a year to support you, but avoiding the really bad stuff, making sure that you're washing your food appropriately. Parasites are through fecal oral contamination, and you don't want to over antibacterial soap your hands, but making sure you're clean and making sure that like you're washing your hands before you eat your food.
It should be common sense to people, but maybe they're not.
Simple practices like that you can help. And I love the essential oil soaps or things that they're antimicrobial, but they're not going to kill off your good bacteria on your hands.
Yeah.
And then, like I said, supporting your immune system and helping also metals. If you have a high level of metal exposure, it also can encourage parasites to overgrow. So if you are eating a ton of like things that are arsenic or using lead paints and whatever, using things that have high metal loads, then you have an increased risk of just parasites overgrowing.
There's one account in particular, I can't think of which one it is off the top of my head, but they like really bashed sushi and like raw fish. And I was just like, oh, yeah. Recently I'd been eating a lot of sushi, especially during Lent. I was just like,
yeah, but that's also, you don't know where it is, right? So you don't know what's in there, and most fish have parasites in them. And so when you're cooking it, you kill it off. I avoid sushi, especially if I'm going to eat sushi, I go somewhere that's close to the ocean because it just came in. That's another big point is like sushi is just probably not going to be our best friend. People love to like eat like gas station sushi, like all these things. And it's like, even just some restaurants, like I live in Minnesota, like sushi, I'm going to eat cooked sushi. That fish has been raw and has been raw for a while. And even if it wasn't necessarily a lot of them, there probably is more now, and so you got to be mindful of those things. I think there's one place out in California I used to go to that they like made sure that there weren't parasites. So I don't remember exactly what they did, but some of these places care about that and are aware of it. But I just also avoid raw per se, or just be very inconsistent of when you're eating raw fish.
I'm someone who, once I hear something or have like a visual in my head, it like totally just ruins it for me. That's fine. It's probably for the better. Any other foods that can help are more anti-parasitic in nature to include in your diet?
Clove is really good. Pumpkin seeds, the avocado inside seed.
Yeah. Raw garlic. Is that?
Raw garlic, onion.
Okay.
Things that can be really good.
Everyone's going to listen to this episode and be walking around with stinky breath.
And olive oil is also really good. It's like an antimicrobial.
Oh, okay.
For virgin olive oil can be really good for antimicrobial properties.
Fantastic.
know if Manuka honey necessarily, but it's also something good to incorporate because it's great for kids. You think like yeast or bacterial overgrowth. Manuka honey can be really helpful.
That was great. Just an overview on parasites in general is really helpful, and it's probably going to make a lot of people think after listening to this episode. So thank you for that. Do you feel like we left anything out in terms of parasites?
I think your dogs, remember that you have dogs that have parasites, and we know that they do, and we treat them. And then we don't, we're immune to it somehow. And don't get rid of your dogs. I have 2 dogs. I love dogs, but be mindful of it and just support yourself the best way you can. We are to be like stewards to our body, right? We're supposed to steward our body well, take care of our body. It's all as part of like our processes. Like think about like tribes, for example. We had a community. They talked a lot. They had certain processes that they did to help with detox. They supported their bodies in different ways. And so it was just so known that we need to take care of our bodies. We need to take care of and like be a community to talk through things and like support each other. And we are so separate. We like live apart from each other. We don't talk to each other very much. We don't go deep in conversations, especially. We're very like associated with somebody. And then we expect that the doctors are the only ones that can take care of our bodies. And that's not true. We have as much say in our bodies, more so than anybody else. And if you just get in the good routine of, I'm going to sauna, I'm going to work out. A lot of times people are like, well, I don't want to work out. A lot of times the benefits of working out is so many things, but also you're sweating. Toxin. It's a bad sign if you don't sweat. That's also a big thing.
Yes.
It's a bad thing if you don't sweat. You should sweat, figure out how to sweat, step in a sauna, get yourself to sweat, because a lot of times my patients that have high toxic load, they don't sweat. One of my patients was like, it took me an hour to sweat in a sauna. The more you jump in the sauna, the less time it takes for you to sweat because your body are aware of understanding how to do it. Remembering to take care of your body, and sweating is a good thing. Sleeping is a good thing.
I was talking to my husband last night, and we were talking about this conversation you and I were going to have, how I've been having some gut issues. I was saying to him, I'm so glad that all of a sudden this week, I feel like I've turned a new page post surgery, because I used to sleep really well before surgery. And now I've had a stretch of 4 or 5 days where I've been sleeping at least 8 hours. And I'm just like, yes, the most important pillars in my mind of health are your sleep and your gut. Because they, everything affects everything. Like you said, like sweating, exercise is important, affects your mental health, affects everything. Everything works together. But to me, when my sleep and my gut are disrupted, it's so frustrating because I know the impact it can have on the entire ecosystem of your body.
I was conversation with my father-in-law because he used to do a lot of night shifts. And it was like, there is a high correlation with so many chronic illnesses in night shifts. It's not a coincidence that people have an increased risk of heart disease and strokes and cancers. Whatever. It's because your body needs to sleep. Your body does most of its healing between the hours of 10 p.m. and 2 a.m.
Yes,
and so if you are not sleeping during those times, what is your body supposed to do? Because it's not still at 7 a.m. and 12 p.m. because you just, happen to be sleeping during those times. It's your biological clock, and you should care about that. You should care about the circadian rhythm. Try to go to bed at 9:30. At least go to bed by 10, so then your body can be sleeping. Wake up early. I don't care, but try to sleep during those hours.
So important. I couldn't agree more. Tell me about your practice, what inspired you to start your own practice, and what people can expect when they work with you.
I wanted to open a clinic for 10 years. I'd opened up a note in my computer, and when I was in PA school, I had this whole design of what it was going to be. And essentially, my goal is right now with where I'm at, it's me and another practitioner, but eventually branch it out so that we have several different types of practitioners. So not only integrative practitioners, but a mental health therapist, a craniosacral therapist, potentially a chiropractor, hyperbaric in a space, having everything in one spot, that each week we meet and have the conversation about the patient, because we're all going to have different perspectives on what they're seeing. You're going to tell us different things that we're not going to realize. You're not going to spend time telling me that your dog just died because you care about getting through the plan with me and understanding what I'm doing. So then having that conversation with other practitioners, right now I'm doing that with my practitioner that I have now, but eventually it's going to branch off into this bigger space so that we have our different brains all together. And then they can get their therapies all at once, because it's so important for continuity of care. It's important that we're all on the same page. Yes, we're going to have different approaches, and it's great that we think differently, but it's also so that we're doing what's best for the person and then making sure that we're all aligned with it. So that was my drive to want to open the clinic. And now essentially what I have is I do educational visits. So you can be anywhere in the country and world. I have people from all over the world that do educational visits, and we talk through your case. I like give pointers. We should try to put this person on your team or this person on your team. I can't necessarily prescribe or order labs, but it gives you an overview of where to get started. Patients then can fly in, and if I'm spliced in their state, I can continue to virtual visits with them after. Otherwise, the first visit, it's an hour and a half visit. I go through your full history, have you fill out an intake form, a train 10 form. We talk through all your different pillars. We make sure that you have your team established. Like, do we need a therapist? Do we need an oncologist? Do we need a mental health therapist? Do we need a health coach that's helping with your lifestyle changes? What does that look like? So then we walk through that whole process. And then essentially my patient advocate will walk through with patients to make sure that whatever I'm saying to do is doable. Also, then she dives deeper in the different areas of the train that I may not be able to, and be able to make sure that we're healing in all areas of your life, not just one, not just because you're taking your supplements and your prescriptions and it looks great. We need to make sure that we are following up with the therapist, making sure that the diet is doable. Like you're liking the foods that you're eating. You're not stressed out about different components, because we have to take the burden off of you. Because if you're going through the hardest and scariest time of your life and you feel like you just have to navigate it all alone, that's not helpful. And so that's what an advocate is for, is to make sure that whatever we're doing is doable and you feel supported and you feel confident in what you're doing. And that's just the starting piece of where I'm at right now with my practice. Is it's me and her. I have nutritionists that I refer to, that I talk to on a regular basis. They're not a part of the practice, but I talk to them regularly as much as I can. And so we'll just continue to grow. But yeah, that's the goal of it, but then also what to expect if you came to see me.
Awesome. Thank you. A couple more questions before we wrap. So what do you think is one thing that is most misunderstood about cancer?
That, well, it's a genetic disease, that it's just bad luck. And that's not true. There are cancers. I have seen cancers that have a high genetic component. Just because you have a genetic mutation that causes cancer does not mean that is the only factor, though.
So
definitely
true.
It can encourage the fact that you got cancer, for sure. But just because you have a genetic component to it does not equal causation. You can have so many genetic SNPs but not have the symptoms of it.
Lifestyle is huge.
Recognizing that you can be empowered to take control of your health. You just need to get the resources around you. And a lot of times people feel helpless, like, well, I can't do anything. I just have to put all my trust in somebody else and hope for the best. You have more ability at that time of your life to take control of your health than ever before. Also, take advantage of the fact that people want to wrap their arms around you and walk through this with you. A lot of my patients are like, I don't like other people helping me. And it's like, sometimes the Lord brings people, not that God makes people have cancer, but in that process, there's something beautiful about it, because you are able to allow other people to bless you in a way that you never were able to let somebody do it before.
Oh, true.
And then you are also a blessing to other people by watching you go through this, because depending on like what you're doing, like some of my patients are the biggest advocates for themselves and are the biggest proponents of like taking care of yourself. And you now are blessing other people to teach them and educate them. You can be in the deepest valley you've ever been in your entire life, but yet be the biggest light that you've ever been in your life, because you are showing them that there is so much more that you can do, even when it's scary, even when it's dark. I just love patients to be able to like change that mindset of, this is it. This is the end of my story. This is all I have left. Switch that mindset. Don't let the enemy tear you down, and allow yourself to rise from the ashes and know that you have much more ability than you realize, that you can be supporting yourself and loving on yourself in ways that you never had the ability to do before, or thought about, or thought that you could do.
What a beautiful answer. I get different answers from everybody I ask. It's really interesting to me. This was one that I haven't heard before, but it's one that everyone needs to hear, no matter whether you have cancer or not. Anything going on in your life, you can take control over. Anything, I promise. There are certain things we can control, and I've talked about this on other episodes before. We can control our actions and how we choose to respond, and the meaning we assign to things, and what we think in our head. The fact that you encourage people to put themselves in the driver's seat of their health and find doctors that will work for you, find an integrative support team, lean on your people, be loved, be prayed for, be blessed, and know that there are solutions, even if you don't feel like there are. There's so much. I think we've done a great job of you sharing so much of how you work with people and what you've learned, and all these different theories and ways of helping people heal that are well beyond the training and understanding currently of conventional care. There's so much that you can do, even if it's just getting outside and managing your stress, going for a walk in nature. Those are things that are free. Those are things that you don't need to have a ton of money or resources to be able to do. So I love that response because I like to put people in the driver's seat when I work with them as a coach. And I think it's so important to realize that you have that power within you. So thank you for that really beautiful answer.
Thank you for having me.
Yeah, I have one last question that I ask everybody that comes on the podcast. What is it that keeps you moving forward in life? You're on the Forward Think Tank, and it's a place where I want to propel action and thought. So what is it that drives you to keep moving forward?
So when I was young, I had a kind of rocky childhood, okay? And I knew that I wanted better and I wanted different for my kids. And essentially, the Lord has just showed me that through all of my trials and through the dark times in my life that I didn't understand how I was going to get through, that there was a purpose and He can turn that into good. And so my goal is for the rest of my life that I am going to do the best that I can to help people in the darkest times of theirs. And that I don't know everything and I'm going to continue to learn and know as much as I can, but also be the encourager that I wish I had and to allow people to see the light because I understand what it feels like to feel like there is no light ahead of you. That is the biggest thing that I choose to do and I want to do. And I want to show that to my children because the world needs some light out there. And I think there's a lot of ways and rabbit holes that you can dive into that can make everything feel really dark and scary and that there's nobody good. And I don't want that to be the case. I want there to be people that allow people to see the goodness of God. You don't necessarily have to prove it. You don't have to necessarily tell people you should believe in Jesus Christ. You don't have to say that out front. You don't have to do that. You can just show and be love. And that's all that you need to do. I just want to be able to just have my hands open and just whatever person walks in my door, I'm just able to love them and help them with wherever they are in life, no matter what they believe, no matter what they are. I just want them to feel loved and cared for and seen.
There have been very few episodes that I've gotten like this, and talking to Callie was definitely one of them. And I'm so glad that she found you. I knew as soon as I asked you that question, you went, "Ooh," I was like, okay, we're going to get emotional. I tend to really go there and feel that with people. So thank you for that. I mean, it's been obvious to me. We don't know each other, right? We've had one conversation prior to this, but you are such a bright light. I can see it through the screen. I wish I could hug you in person. And to have had whatever experiences you had growing up as a child, whatever experience is we have as adults that can make an impact on us, right? We can learn and we can rise from them. And then we can help others. Some people don't see it that way, but choosing the high road and choosing to also make an impact on your children and say, I'm going to be better, I'm going to do better, and then open up your heart and open up your practice to help countless patients do this work that's so important. And like that story that you shared of the woman who has overcome her stage 4 cancer is now like living a vibrant life. Like it goes such a long way to have people like you doing this work. It's so important. I love everything that you've shared and the way everything kind of came together. Even if it didn't feel you had it all figured out in the beginning, it really seems like you've built something great. And I'm just so excited. I hope we stay in touch. I can't wait to see how the practice grows. And I thank you for being here and reaching out and expressing interest because this conversation needs to be heard. So thank you.
Thank you. I appreciate it so much.
Yeah.
It's been an honor.
Of course.
All of the things. And if there's any way that I can help you too in expressing more about whatever I talked about or want to dive deeper, I'm happy to do so.
Thank you. Thank you. I will include in the episode notes how people can get in touch with you, your website, or I will link your website. I will link Instagram. And I really thank you again from the bottom of my heart for taking this time.
Of course. Thank you so much. You're doing awesome to be able to walk in what you're walking through and to be able to be like, nope, I'm going to help people and still love on people. I know that's hard. I know that isn't easy because it's like, well, I have my own stuff going on, so I can't care about other people, but you are. And that's a blessing to so many people. And I want you to continue to do this because you are the epitome of taking a dark situation and bringing it to light and not letting it drag you down or make you feel like it has consumed you, that it's not going to consume you, that it does not have control over what you do. No matter how dark things can get, you are still you. You are still perfect and created beautifully. And you are going to continue to be a light regardless of whatever valley you walk in. And that's awesome.
Thank you. I appreciate that so much.
How amazing is Alicia? This was one of my favorite conversations to date because this girl is so brilliant. You can tell how passionate she is about every single topic. And honestly, she is just a kind, pure soul. And you can tell how much she loves working with all of her patients that come through the door. So she is offering $50 off an educational visit when you mention the Forward Think Tank podcast. This offer expires Tuesday, July 1st of 2025. So again, $50 off your first educational visit, a chance to work directly with Alicia on your health and your healing. Offer is good through Tuesday, July 1st when you mention the Forward Think Tank podcast. Thank you so much, Alicia. This conversation was amazing. I hope you all enjoy and please take advantage of this offer. It's the absolute world to me. Thank you so much for being here. Thank you for listening, and I will see you soon.